what's distinct about the AOA and what distinguishes it is that it's really a leadership organization. It's an organization of leaders trying to lead our profession, that which does the musculoskeletal care for patients. It's focused on topics that are broader than individual subspecialties. It's focused on topics of leadership, on issues that are critical to the care of all musculoskeletal patients, and on topics that are generally broader than what we see in our typical specialty or subspecialty society clinical meetings.
I truly enjoy the AOA annual meeting, and some of the things I take away from it are not necessarily strictly orthopedic related. For example, this morning there was an excellent talk on teaching and how to tell a story to get your point across. And when the speaker is talking, I realize that I use some of those things in the talks and courses I give, but not nearly as well as I could. And I think that's something that I've realized, and I find it really very helpful in my career and my profession to be able to take those non-orthopedic nuances away from a meeting such as the AOA.
One of the most relevant reasons to be involved as an AOA member is that it's really the only organization that we have in our specialty of orthopedics and the subspecialties that's not strictly just based upon the sciences and the data, but it's an organization that is shaping the future for orthopedics. Many organizations are celebrating their past and looking at their heritage, but AOA is continuing to focus on leadership, it's continuing to focus on new frontiers, and I view it as while other societies are celebrating their past, the AOA is shaping the future for both all of us that are currently practicing as well as many generations to come.
One of the unique things the AOA does is it really brings leaders in our profession together to tackle issues that are broad and extend entirely across the profession. Issues such as how to best coordinate and plan for the future of resident education. Issues like bone health and fragility fractures, things that aren't taught typically in another clinical kind of orthopedic meeting.
One of the things you always take away from an AOA meeting is a new leadership skill of one form or another that you can apply at home.